Now let's talk about some of the more common conditions that you see in your practice. Interestingly enough, you can see anything from acute conditions to chronic conditions, and you've treated the gamut of them, which is wonderful because you've been in practice for so long. So let's start with an acute condition. Someone comes in, high fever, ear infection. How can natural medicine help that person?
Well, sure. With infections, we do have many different treatments we can have to bolster the immune system, whether it be immune-enhancing herbs, supplements. We use things like hydrotherapy, alternating hot and cold applications to stimulate the body's own immune system. So what I do with patients, and most doctors do in my field, is if we can treat the patient just naturally for an acute infection, so things like earaches, the common cold, for example, coughs, bronchitis, a lot of the common conditions, again, using natural medicine, we can treat them effectively enough. They don't need pharmaceutical medications. Now, if they're so severe they need them, we'll use them, but in the vast majority of cases we don't. So don't underrate natural therapies when used properly with trained naturopathic doctors to treat even acute infections.
Now, what about something more long-term, like arthritis, for example?
Right. Well, there's different types of arthritis. Typically, we see patients with osteoarthritis. That's where you get degeneration of your joints. And we work with them on their diet, getting the nutrients they need for tissue and joint healing, working with them on things like even digestion you wouldn't think about. So in other words, the better you digest your food, the less toxins you have in the body, the better nutrients you get to your joints. We use joint-specific supplements, which help the cartilage to have reduced inflammation, build the cartilage up to a minor degree, help with mobility and stiffness and other symptoms, and really help with the chronic inflammation you find with most types of arthritis. You have things like rheumatoid arthritis, which is an autoimmune condition. Then we're still working in those types of areas, but balancing the immune system out, not necessarily stimulating it, but balancing it, and again, getting a natural anti-inflammatory approach.